Okay. Got my stethoscope. Hello, my name's Coden, and I'm going to be your nurse tonight. Are you mom? Yes? Awesome. All right. So we got to do a quick assessment on your baby. So whenever you have a minute, I'll go ahead and take him and we'll get our assessment done. And for this video, we're just going to assume that this baby is somewhere between newborn and an infant. So yeah, that's what this video will be. All right, Mom, I'm just gonna see baby for a second while we do our assessment. All right, we got the baby in his crib. So we're gonna start our head to toe. We want to visually assess the skin, note any injuries, lacerations, bruises, stuff like that. We want to palpate first the anterior fontanelle, palpate the sutures, along the sutures, palpate the posterior fontanelle, make sure that the head is, well, note if the head is normal cephalic or if there's any abnormalities with it. And we can check out the ears, look in the ears, note if there's any drainage, injury, redness, stuff like that. Check out the eyes. Sometimes the baby will have their eyes open, sometimes they'll be closed. So if they're open, then might be a little bit easier to visualize their eyes. So you can pull down their eyelid and view the conjunctiva, make sure that everything's pink and that the whites of the eyes are white, sclera and stuff like that. We can move down to the nose, ensure that the nose is intact, and you can kind of get a little bit of information about the baby's breathing. If their nostrils are maybe flared, it might be indicative that they are having difficulty breathing. So yeah, I want to note stuff like that. Also, we're palpating the skin as we go down. We want to note if we feel any lymph nodes, if they're tender, which the baby can't really tell us if they're, tender or hurting, but we can maybe get an idea with nonverbal communication that helps with our assessment. So you can feel in the armpit area for the lymph nodes, the inguinal, places like that. Also want to palpate the neck to make sure that the clavicles are intact and they're not fractured or anything. And we're going to, through the whole body, just palpate it. Not the abdomen yet, but after we auscultate the abdomen, we can palpate. But we just want to note any crepitus on the baby's body. We're also going to note the skin turgor. Okay, check the belly a little bit. Note just the general appearance of the baby, like if there's swelling anywhere, color of the skin, nail beds, mouth, like we're assessing everything. So yes. And when we assess the mouth, we want to assess the palate. So you can put your gloved pinky in their mouth and put your pinky up to the roof of their mouth to palpate their palate and make sure that it's intact. You can also test the sucking reflex while you're feeling for their palate. If their tongue can reach up, then they probably don't have a tongue tie, but you can still just lift it up and check, see if there's one under there. As we're going down, we're gonna also want to assess our pulses. We're gonna do the main pulses, so like the carotid, brachial, radial, femoral, popliteal, pedal, Make sure that those are all as they're supposed to be. And let's just listen. Start there. Okay. So when we're listening to the heart, there's like 4 or 5 main areas that we listen to. We listen to the pulmonic, aortic, Erb's point, and then tricuspid and the mitral valve. Oh, we can also listen to lungs, and if the baby's crying, it'll be easier to hear. But this is not a real baby, so I'm not hearing anything. Also listen to the stomach, 4 quadrants. Note any abnormal sounds with the heart, like pushing, skips, stuff like that, because they might indicate an underlying problem like a murmur or something of that sort. Note any unusual sounds in the lungs, like wheezes, crackles, not just the lungs, but when you're assessing the respiratory tract, stridor, stuff like that, because that is most likely not normal, and we don't want that. So after we auscultate the stomach or the abdomen, we can palpate. Note if the bladder is palpable, like how far it's palpable, or its size. If there's any masses or lumps or bumps that shouldn't be there, you would note all of those, or we would note those as well. And okay, so I'm not sure what I've covered already because I kind of got out of order, but we want to count fingers and toes, 5 on each extremity. Maybe note if they're conjoined or joined together. We want to do range of motion. If the baby's awake, they might be moving their arms and legs, and you can kind of get a good idea of their range of motion then. And then you can test grip strength. They'll grab onto your fingers. Maybe some push and pull. If they're flailing, not flailing around, but you know, moving and grooving. Also just assess the skin on the legs. Check capillary refill in all 10 toes and fingers. Last, we're kind of moving toward the genital area and the anus. So since this baby is a boy, we're going to proceed with assessment. If the baby gets circumcised, you would want to know if there are any sutures or stuff like that, the approximation of the sutures, if there's any drainage, foul odor, color of the drainage amount, stuff like that, if it's purulent, etc. So also palpate the testes to ensure that there are 2 there, and then you can check baby's back, kind of like a 2-in-1, I guess. Check their spine, make sure that their spine is straight, midline, I guess you could say. Note if it's curved or if there's any deformities or unusual factors going on. And then you can assess the anus. So you want to make sure that the anus is intact, that they do in fact have one, and if there are any fissures or any abnormalities like that, we would want to note that too. Okay. All right, I think we're done with this assessment. I might have forgot a few things because I skipped around, but what else? I don't know if I mentioned that you can assess the cranial nerves when the baby's moving their face around. If they're awake, then can kind of get a good idea of the functioning of the cranial nerves and stuff like that. And for the history, you can ask wonderful resource, the mother or the father, most likely probably the mother, but yeah, that's the end.